Now let's do this NCLEX style question today. So if you are the nurse caring here for a patient who has pneumonia and observe that the client temperature increased to 102.1 degree Fahrenheit. So which of the following actions should you take first? The A option is measure the client blood pressure and pulse. B, auscultate the client breath sounds. C, contact your healthcare provider. And the last one is prepare supplies to obtain blood culture. Let's take a second to think about it and comment your answers below. Okay, so the right answer for this question is number one. Now let's see how to handle this question together. So if you see, they're trying to asking you what you will do first, and the keyword here they give you the temperature is 102.1. So the patient has a high fever, and this is pneumonia patient, right? So in the first and second option, if you noticed very carefully, both are the part of assessments, and the third one is calling physician, and the fourth one is gather supplies, right? You don't want to pick the fourth answer because definitely it will take a lot of time to do this procedure, and you want to do something quick, faster as initial first action in case when your patient has a high fever, right? Now, you do not want to call the doctor here first because you do something as an RN first before you call the doctor as well. Even in case of an emergency, always try first, do something first by yourself if you can, right? So here definitely you can do some assessments. So now between 1 and 2, why the answer is 1, why not number 2? Because you want to check the signs for the septic shock here as well, because if your patient has a high fever, you really want to check the pulse for the tachycardia and also the blood pressure, which is for hypotension. So if you notice that the signs of septic shock, which could be possible in pneumonia case as well, so definitely you want to take the action ahead of time. Number 2 can wait here, that kind of assessment. Even I know a lot of nurses will think here airway comes first, right? But always check the airway if it's needed. But here in the question, it doesn't really say here the oxygen is compromised, so which can wait. I hope you understand this question, how to handle this together. And if you have any other question for me, comment in the answer below. Thank you so much.